skull. Within your skull bones, there are sinuses. The sinuses are air pockets within the bone. One, it makes them lighter, and two, it helps resonate the sound of your voice. When your sinuses are full of mucus, your voice is going to resonate differently, sounding different. We have 4 different sinuses that we need to know. We have the frontal sinuses. The frontal sinuses are located here in the forehead in the frontal bone. Then we have the sphenoidal sinus, or the sphenoid sinus, which is the yellow. If you look from the side view, it's the larger one in the back here. The ethmoid sinuses are in front of the sphenoid, and there are a bunch of little ones here in the green. And then we have the maxillary sinuses. The maxillary sinuses are here. And when you do have a cold and when they are full of mucus, they are going to create pressure. So you might feel pressure here or here, and that's because of the sinuses full of mucus. First bone we're going to look at is the frontal bone. Frontal bone makes up your forehead. This yellow bone here and here is your frontal bone. On the frontal bone, one thing you do need to know is the supraorbital foramen. Just above the eye sockets here, there are 2 small holes. This is for passage of blood vessels and nerves to innervate the top of the forehead. So there are small little holes in the bone. They're called supraorbital foramen. The parietal bone, there are 2. There's one on the left and one on the right. That would be here. And on this picture, you can barely see it there. Then we have the occipital bone. The occipital bone is the base of your skull. There, and then here. This is looking from the bottom up. The foramen magnum is a hole in the occipital bone that makes way for the spinal cord to attach to the brain. Foramen magnum is here. The occipital condyles are on the outside of the foramen magnum. They articulate, or they form that joint with the first vertebrae, and they are here. The temporal bone is here and here. Just looking at 2 different views of it. On the temporal bone, a couple things that we need to know. The external acoustic meatus, this is your ear hole, this hole here. You can also kind of see it here and here from that view. The mandibular fossa, this is where the mandible or your lower jaw connects in to the temporal bone, to the rest of the skull. It is located here on the pink bone. It's kind of that divot on the pink bone. When we're looking at the orange over here, you can kind of see the depression that it leaves right here. So it's on the pink bone, it's that depression. The mastoid and the styloid process, these are for attachment of different muscles in the head. This is the mastoid. The styloid is the pointy one. It is right here. You can kind of see it on the orange picture. The styloid is here and the mastoid is here. It's harder to see on that picture, but that's where they're located. The mastoid you can actually feel. It's this bump right back here. The zygomatic process of the temporal bone forms the back end of your cheekbone. The zygomatic process is here. It's easier to see it on this view. It's the orange part of that arch that sticks out. The sphenoid bone, and again those sphenoidal sinuses are within this bone, is here. When looking from the front view, it's here, the purple. On the sphenoid bone, there's a process that we need to know. It's called the sella turcica. This view is as if you took the top of your head off and took your brain out and looking down in at the skull that way. The sella turcica is this here. The ethmoid bone is mostly within the skull, and it's very difficult you can see a little bit from the side view, but it's more an internal bone than it is an external bone. In this view here, this is the ethmoid bone. The ethmoid bone is that right there. There are some processes on the ethmoid bone we need to know about. We have the cribriform plate. The cribriform plate surrounds that there. Then we have the crista galli. The crista galli is the attachment point for the membranes that encase the brain. It is in the center of the cribriform plate. It is here. It actually, when you look at it from the side, it sticks up. So looking at it here, it is this portion here that sticks up. Make sure you look at the skull we have in class to kind of get a better idea of what the Christogaly looks like. There is the perpendicular plate, also part of the ethmoid bone. This creates the nasal septum in the nose. On the front view, so that the x-ray picture is looking straight on frontwards, there's the perpendicular plate. Here is a perpendicular plate on that view. Sutures are the joints between the skull bones. They are immovable joints. They're actually fibrous joints. There's fibers that kind of hold them together. When you are born, these are unfused, allowing your head to compress. The first suture is a sagittal suture. The sagittal suture runs down the center of the skull. It separates the right from the left parietal bone. It is there, and you can kind of see it at the very top there. And remember, sagittal is 1G, 2 T's. The coronal suture is on the crown. Coronation has to do with king, so it's where the crown is, so it's this here. So it is there or here, depending on the view. The lambdoid, this also could be the lambdoidal suture, is at the base of the skull here, separating the parietal bone from the occipital bone. You can also see it here. The squamous suture. The squamous suture essentially separates the parietal from the temporal bone, which is here. Onto more bones of the face. The maxilla is the upper jaw. We have 3 different views here. We have this from the side, it's the orange here. We have from the front, which is the orange here, and there is actually 2 maxilla bones. There's one on each side. And then we have the maxilla here, the purple here. So the all that purple is the maxilla. We have the palatine process on the maxilla bone. The palatine process makes up the roof of your mouth, or the majority of the roof of your mouth. This purple here is the palatine process of the maxilla bone. The other process on the maxilla that we need to know is the alveolar arch. The alveolar arch houses the teeth. So this would be the alveolar arch here or here, depending on the view. Then we have the palatine bone. The palatine bone connects up with the palatine process of the maxilla. This makes up the back portion of the roof of your mouth. So it'd be here, that green bone. Then we have the zygomatic bone. This makes up the front of your cheekbone. This will connect up with the zygomatic process of the temporal bone. So this is the zygomatic bone here. On this view, it's here. On this view, it's there. Process on this bone is the zygomatic arch. The zygomatic arch is actually made up of 2 bones. We have the zygomatic bone and the zygomatic process of the temporal bone, both making up the zygomatic arch. From this view, we have there and there. So these 2 bones together make up the zygomatic arch. The next bone is the lacrimal bone. The lacrimal bone is a very small bone on the inside of the orbit. Here and here, they're very small scale-like bones. They're right on where your tear ducts come in. So they're right here on the inside of your eye. Then we have the nasal bone. The nasal bone makes up the bridge of your nose. So it'd be here or here. Then we have the vomer. The vomer makes up the bottom portion of your nasal septum. So it is this bone here, right on top of the maxilla. Most of it is on the inside of the skull. In this view, it is this small little nub there. But from the side view, kind of split halfway open, this whole bone is the vomer bone, just underneath that ethmoid bone. Then we have the inferior nasal conchae bone. This is part of the scrolls in the inside of the nose. This helps turbulate the air to help warm and humidify the air as it comes in. From the front view, it is this lower scroll kind of sticking out in the middle of the nose there. From the side view, it is here. So it's just behind the vomer. So if the vomer will sit right on top of this, and the ethmoid will sit kind of up here. So the ethmoid, this is on the sides of the nose where the ethmoid and the vomer are towards the middle. The mandible is the lower jaw. The mandible is the only movable bone in the skull. The mandibular condyle is the part of the bone that articulates with the rest of the skull. It sits in the mandibular fossa of the temporal bone. This would be the mandibular condyle, and in this picture, that is a mandibular condyle. So this is what sits up in the mandibular fossa. Then we have the coronoid process. This is where muscles attach to the jawbone. Coronoid process is there. On this picture, it's right there. If we look at the infant skull has a smaller face, a larger forehead. It's not proportional. It is incomplete as the bones are not fused together, which creates open fontanelles. This is what would be considered the soft spot. The bones do not fuse together, allowing them to compress in order for the skull to fit out the birthing canal. There are two soft spots. The larger one is here in the front, and then there's a smaller one here. But none of those bones are completely fused. It takes about 2 years or so for those bones to completely fuse.